Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moment on Tuesday Night Anatomy with Daniel Okwan. Today's section, I quickly run with you the oculomotor nerve. Now get to know that this oculomotor nerve is actually the third cranial nerve. Yes, already I've done the video looking at general aspects regarding, of course, these cranial nerves when you look at the ventral aspect of the brainstem. So it means that this oculomotor nerve, yes, it's also one of the nerves where it's coming from, of course, the ventral aspect of the brainstem. But I told you that it will be coming actually from the midbrain. And precisely, yes, you know that the midbrain, yes, two nerves are emerging there. One is, of course, the third nerve, okay, the oculomotor nerve, which will be running along the, the ventral aspect. There will be another nerve, that's the fourth nerve. You look at those ones, the trochlear nerve, which will be emerging from, of course, the dorsal aspect of the brainstem. But precisely, this oculomotor nerve, yes, will be emerging at the level of what we call the superior colliculus. Yes, of course, because this cranial nerve, yes, is having its nucleus, that is what we call the oculomotor nucleus, yes, eventually giving that motor supply to, of course, these extraocular muscles, okay, except two of them, which I'll be making mention of. But in addition, there will be another, yes, nucleus adjacent to it, that one we call the Adinga vestral nucleus. And that one will, of course, be supplying, eventually giving fibers supply, of course, the ciliaris muscle and, of course, the sphincter pupillae muscle. Okay, so it means that at the end of this section, we should be able to tell the cause and, of course, innervation of this, of course, oculomotor nerve. Not forgetting that there are nuclei being oculomotor nucleus and, of course, the Adinga vestral nucleus. And so, without much ado, let's set the ball rolling. So there we are now. So if you look at this whole section schematically, it gives you the full picture of what you have to know about the oculomotor nerve. Okay, so one thing, this is the brainstem. Okay, this structure that you find over here. Okay, this is a transverse. I show you actually the brainstem. Okay, so there's the brainstem. And one thing that we find, okay, is that within that brainstem, at the level of what you call the superior colliculus, we find that within, okay, deep, within this, gray matter, what you call it, periaqueductal gray matter, okay, and this periaqueductal gray matter, okay, deep in it, I have the oculomotor nucleus emerging. Remember that because we are going to have these two oculomotor nerves, it means that we're also going to have two oculomotor nuclei, okay, one on the right side, one on the left side, and emerging from there will be the nerve. So this is the oculomotor nucleus. But what do we find? We find that in the midline, these two oculomotor nuclei, okay, fuse in the midline. Okay, they fuse in the midline. That's an important relation because I'll talk about something else as well. Okay, that is the fusion point of the oculomotor nuclei, left and right oculomotor nuclei. Okay, so that one is that one. So I told you that it is actually found deep in what we call the periaqueductal gray matter. It therefore tells us that yes, this nucleus, okay, will actually emerge anterior or ventral to what we call the cerebral aqueduct of Sylvius. So is that another important relation? Yes, we are saying that it is emerging from the periaqueductal gray matter. It means that this nucleus, oculomotor nucleus, yes, will be emerging, ventral or anterior to what we call the cerebral aqueduct of Sylvius. Now, once it emerges over there, now you see that the nerve will be coming out of the nucleus. Okay, so what do we see? We see another nucleus over here, just anterior or just ventral, okay, to what we call this oculomotor nucleus. We have what we call the red nucleus, Okay, so it means that the nerve, oculomotor nerve, will run through the red nucleus. And then from there, you see that we said it's emerging from the midbrain. Okay, there are two cerebral peduncles. Okay, these are cerebral peduncles of the midbrain. Okay, and it is emerging in between them. So the nerve will be passing in between them. And that is why we say that this nerve, which is the oculomotor nerve, is that only cranial nerve which is a content of what we call the interpeduncular fossa. So the fossa over here is known as interpeduncular fossa. The only cranial nerve which is a content of this interpeduncular fossa. Okay, so that is one thing that you have to know. And then from there it will be merging through these two arteries that we find over here. That's also an important relation which you should know. Okay, there's one artery above and one artery below it. The artery above, okay, is known as the posterior, cerebral artery, posterior cerebral artery. Okay, that is what we find. And then the artery below is known as superior cerebellar artery. So one thing is that they can ask you which two blood vessels do we have the oculomotor nerve, running between. And the answer is what we call posterior cerebral artery above, and then below we have superior cerebellar artery. Be careful, the superior one is cerebellar artery. The above one is cerebral artery. Okay, then from there we go on, and then we see that in the middle cranial fossa we find what we call the sella turcica. But what I'm interested in, boundary the sella turcica, I have what we call the posterior clinoid processes. So it will run lateral to the posterior clinoid process. Okay, it will run just lateral to it, and from there it will also be running the lateral wall of what we call the cardinal sinus. Now, those of you who have not watched the cardinal sinus that I've done already, I told you that there were some important nerves which are in the lateral relations, and one of them is the oculomotor nerve. It doesn't run in the inside, it runs on the lateral wall of what we call the cavernous sinus. That's an important relation. Now, then from there, it emerges out, and of course, it divides into two. Now, it's supposed to run through this, enter the orbit, enter the eyeball, yes, by running through what we call the superior orbital fissure, okay, over there. But before it enters the superior orbital fissure, just after coming out of the cavernous, right from the lateral wall of the cavernous sinus, it divides into two. And these divisions, yes, we have what we call the upper division or the superior division, and of course the lower division or the inferior division, okay, of the oculomotor nerve. Then so we go through what we call the superior orbital fissure, and then once it gets there, it gets access to what we call the extraocular muscles. Now, one important thing that I want you to know is that the superior division will be supplying two muscles. And what are these two muscles? Yes, the main one will be what we call the superior rectus muscle, and then some of the fibers, okay, of what we call the upper division will also be supplying what we call the levator palpebrae superioris. Okay, smaller portion will be supplying levator palpebrae superioris. So these are the only two muscles, okay, at the upper portion, yes, of the eyeball. So you can see there's the eyeball. These two muscles on the upper portion of the eyeball, yes, they will be supplied by, of course, the upper division of the oculomotor nerve. It makes sense. So superior rectus and, of course, levator palpebrae, superioris. Now, for the lower division, okay, yes, that one will be supplying three muscles. And those muscles are highlighted in orange, and you can see that one of them is the medial rectus, okay, medial rectus muscle. Yes, not only that, the inferior rectus muscle, as well as, of course, inferior oblique muscles. So these are the muscles which are supplied by, of course, the lower division. Now remember, we know that, of course, lateral rectus will be supplied by, of course, the abducens nerve, okay, cranial nerve 6. So, we know the LR6, okay, so that one is out of the picture. And of course, superior oblique is rather supplied by, of course, the trochlear nerve, the fourth cranial nerve. We'll look at that one later. So right now, what we want you to know is that if it is the upper division, it's supplying the superior rectus as well as levator palpebrae superioris, then the lower division of the oculomotor nerve will be supplying, of course, medial rectus, inferior rectus, and of course, that of the what you call inferior oblique muscles. And lateral rectus and superior oblique are out of the picture because they will be supplied by, of course, the sixth and, of course, the fourth cranial nerves respectively. But there's some important things that I want you to recognize over here. Now, I told you that these fibers are meeting in the the oculomotor nucleus, yes, left and right oculomotor nuclei are meeting in the midline. And that is why there's one important question that I once chanced on, and it says that which of these extraocular muscles, yes, is supplied by the contralateral, nucleus. Okay, fibers from the contralateral nucleus, and the answer is simple. The answer is actually the same, the superior oblique again. Yes, you can see that the fibers, yes, if it's coming from the right side, to be going through, there's no decreasation over here. You can't see anything like that. But one thing that we find is that the fibers, which will be eventually, studies have shown that the fiber which will eventually be supplying superior oblique, yes, will be coming from the contralateral nucleus. So it means that if there's the right one, then from the left one, the nucleus, the fibers will be running this way. The fibers supplying only superior rectus muscle, okay, will be coming from what we call the contralateral nucleus. And that kind of decreasation, we call it intranuclear decreasation. The decreasation is taking place at the level of the nuclei. Okay, so that is what I want you to know over here. So having seen that, now one thing is that yes, this oculomotor nucleus, the main nucleus we talked about, is actually the somatic component. Why? Because it's eventually going to give off those fibers to supply the extraocular muscles. But this time around, giving that kind of fibers, okay, to control the dilation of the pupil, the contraction and relaxation of the ciliaris muscle, is by the other nucleus which is just adjacent to it. We call it Edinger-Westphal nucleus. Okay, so that is the Edinger-Westphal, just adjacent to what we call the main motor oculomotor nucleus. Okay, so I have the Edinger-Westphal nucleus. So that one, two fibers will be coming out. So we can see the nerve which will be coming out, which joins to form the oculomotor nerve. So the oculomotor nerve, you can say, is not, yes, it is not only giving that kind of motor supply to these extraocular muscles, but it's also controlling, giving parasympathetic. The word is parasympathetic. Now, one thing that we got to know the other time when we looked at the overview of these cranial nerves was that, yes, cranial nerve 3 is a parasympathetic nerve. So it means that, yes, together these ones will form the oculomotor nerve. The nerve will be coming through the Edinger-Westphal, the nerve will be coming through the oculomotor, the motor nucleus itself, okay, all join to form what we call the oculomotor nerve. We've seen the relation where the, before entering what we call supraorbital fascia, we know that this oculomotor nerve we divide into upper and lower divisions to supply the extraocular muscles, no problem. But one thing is that one of the fibers supplying the lower division, okay, supply actually inferior oblique muscle, supplying inferior oblique muscle, okay. So the nerve to inferior oblique muscle is that nerve through which this, Edinger-Westphal, the fibers coming from Edinger-Westphal, okay, will be running with it. You can see it's running with the oculomotor, the main trunk of oculomotor nerve. Yes, it goes to the lower division, but eventually it will be running with the nerve supplying what you call inferior oblique muscle. This one could be also a good question for you. And then imagine then it gets separated over there. And then over here, the one I've highlighted in green, okay, is the only ganglion in what you call the orbit. We call it ciliary ganglion, of course, from between, of course, the lateral rectus and then of course the optic nerve. I have this ciliary ganglion, okay, over there. And then once this, the fibers coming from the Edinger-Westphal nucleus, okay, once they get to the ciliary ganglion, they relay over there, okay, and then emerging from the ciliary ganglion will be some short ciliary nerves. There will be several of them, not only one. There will be short ciliary nerves. But what are these short ciliary nerves doing? They are going to give parasympathetic innervation to what we call the ciliaris muscle, okay, ciliaris muscle. And not only that, also to what we call the sphincter pupillary muscle. Yes, we are calling it constrictor pupillary, the same thing, sphincter pupillary muscle, but not dilator pupillary. Please get to know, not dilator pupillary, because dilator pupillary, yes, dilatation of the eye, okay, by the pupil is by what we call is by sympathetic route. We are talking about this Edinger-Westphal, yes, carrying parasympathetic, okay, innervation to these fibers, and that is why dilator pupillary is out of the picture. It's rather sphincter pupillary and of course ciliaris muscle. Okay, so this is what I have for you today. I hope you find it helpful. Have a good night, all of you, and may the good Lord richly bless you. Amen.